just as a parent, be kind to yourself. It's a busy time, and it's been on the back of a busy time. Summer is really enjoyable time, hopefully for most families, but it's often very busy and tiring. And then you're starting to get back to the routine and all of the planning involved. So just be kind to yourself. Take that sort of collective sigh of breath, particularly after the first drop off.
Welcome to the HSE Talking Health and Wellbeing podcast. Today I'm joined by Dr. Abigail Collins, Consultant in Public Health and National Clinical Lead for the National Healthy Childhood Programme. Abby has many years of experience in keeping children healthy, and she's also a mother of 4, so she comes with a lot of personal experience. She's going to share with us today some invaluable insights on how to navigate common illnesses, build a strong immune system, and maintain a healthy routine during the school year, and particularly in preparation for that school year. So grab a cup of coffee, settle in, and let's get started on making this school year the healthiest one yet. So thank you very much, Abby, for joining us today. And I'm not sure about you, I'm a mother of 4 as well, but I always find September like being the real new year. I don't think of January as being the new year, but I think of September, because all the kids are going back to school. The couple of weeks before, everybody's getting a little bit anxious. Maybe they're not sleeping. And I thought maybe we'll start there and what's going on in a house.
Yep.
With all of the kids getting ready.
Yep, that's exactly right. I think the same August, September time is the real business, back to business start, isn't it? And yeah, it's a busy time. And, you know, you've had the long summer holidays. People have gotten out of all sorts of routines. And for some, that's a great thing. For some children, it's a great thing. For some parents, it's a great thing. And for others, actually, it's a challenge. You know, we're all different, both adults and children. Some of us really respond better to structure, and we'll be looking forward to some of that structure coming back. And others are a little bit more reticent about it. So I suppose come mid-August or even early August, as a parent, you start to think about this back to school routine. And, you know, that starts with the early practical things like the school shoes and the school bag and the books and all of that sort of business, and making sure the clothes fit. And whilst that's a kind of nice practical thing for an adult, it slowly builds the children up to knowing that, you know, we're going back to school, particularly for the primary school and the younger end of the primary school age group, whereby, you know, their sense of time is a little bit more elastic. You know, that's sort of that closeness, the horizon coming is a little bit less clear to them than for the elder children who know themselves the kind of countdown. So I think it helps bring us back to that normal, and a lot of the routine slips. So it helps bring some of those routines back a little bit more into play. And that's when you'll get a sense from your children who's sort of looking forward to it. You know, some people are really excited about it. Some, let's face it, probably the majority are a bit more neutral about it. It's just sort of a fact of life, let's say, and there's good and bad bits about it. And for some children, they might start getting a bit more anxious, and they might be a little bit more concerned about it, and you might need to address that or just keep an eye on that over those few weeks run up.
And Abby, what kind of things would a child, if you're thinking, okay, you've gone out, you've got the shoes, you've got the bag, you've got the books, but you still feel there's something just not right in relation to maybe some anxiety. Well, what kind of signs would you see in a child that may be a little bit anxious?
It's good to keep an eye out for certain things. So, you know, most children will be absolutely fine. They might be a little bit apprehensive about, you know, and they might raise that, I wonder what Miss So-and-so's like, or, you know, the teacher they're going into, and you can have a kind of conversation through that. But for some, you might see that, you know, they're becoming a little bit more anxious, want a lot more sort of reassurance than normal. They're a little bit more clingy. They might be prone to cry more, you know, as it gets closer to the school year, or to have sort of outbursts of anger, which are out of proportion to what they might normally be for their age, particularly the younger age of the children. And they might start waking at night, for example, or even, you know, some children start bedwetting when they've been dry. These are all signs that actually a child is struggling a little bit more. And, you know, all children, we're all anxious at times. That's something normal. And over time, we learn that sort of toolkit of how to deal with those kind of episodes of anxiety. But some younger children just need a little bit more help with that, and they might have a little more anxiety than some of their peers or some of your siblings. We've got 4 children each, so all of the children are different themselves. Some aren't anxious, some are a little bit more anxious. So just because one sibling is absolutely fine, you know, the other one coming along may have a little bit more challenges. So look out for some of those things, and just, you don't need to act on the very first, I suppose, episodes or instances when you think they might be being anxious, but it is a little bit of a pattern over those couple of weeks. Is it something that's sort of maybe escalating, maybe, you know, settling a little bit more, that you just need to, you literally have a conversation with them about it. So, you know, how are you feeling about going back to school, and see what they say, see what they're able to articulate. And that might be age dependent, but it's also a little bit personality dependent. So sometimes simple reassurance is sufficient. But very quickly, if there is more of an issue around that, then actually simple reassurance isn't really going to work. You need to explore it a little bit more, because often what they're anxious about could come true, And exploring that with them is something that you can have a discussion around. And, well, it wouldn't be that bad, or this is what you would do, or remember this time when that happened and you were fine, it was okay. It's just helping them understand that what seems like a big challenge can be a hurdle that they can get over themselves. And particularly that they find someone that they can trust and share what they're anxious about, be it at school, be it at home. So for most children, if parents have that sort of a 10 a.m. and they manage to carve out of this really busy time when often there's creative sort of working going on, let alone, home working and job working, etc., and trying to get all of the backpacks ready and the lunches thought of and all of that kind of stuff. But sometimes the child just needs a little bit more time carved out of the busy day agenda, and maybe just that sort of dedicated piece of time can help just to explore some of those things more and just keep things at bay. And I think if you know yourself, you have a slightly more anxious child, there's two things. One, you might have been more anxious as a child. You might have developed good skills around that, but remember back what it was like for school. So just being careful that you don't sort of portray that onto children. But at the same time, you can use that to explain, I was always a bit worried as well, but look, it's fine. Mummy did fine, or whatever, And there are, I suppose, practical tips, like MyChild.ie has some lovely practical tips. A lot of the local libraries, all school children starting school are eligible to free books. So that can be a nice thing to do with your child. Go and get them. You can also look at some sort of self-help books for tips on how to sort of manage anxiety in the family. And some of the websites can be really good for that, like the MyChild.ie and the IPCC website. So, there's lots of tips at a low level to help with, children with anxiety. But if it's something that's pervasive, that is really affecting their ability to go back to school and the daily structure of their lives at school and at home, then that's a time when it might be useful to go and see your GP or self-refer to local psychology services or family resource centres, etc., for a little bit more sort of nuanced understanding of what's going on with you and your child and that family dynamic. Yeah. But that's all perfectly normal. It's just recognising it and trying to sort of nip things in the bud at the earliest opportunity. But when things need a little bit more help, that's fine. That's what, a lot of the services are there for, to support.
So, Abby, with all of those services, and you say there's services out there, people can go to their GP, they can go on to MyChild.ie, HSE.ie or gov.ie. And there is lots of supports out there for parents, which is important, that don't feel that they're alone.
That's exactly right. There are lots of supports and different types of resources out there. They're often different, depends exactly where you are in the region. That might be the best and most accessible to you and most appropriate for the age of whatever age your child is. But look them up. Gov.ie has a lot of those local resources. And also a lot of the local libraries know where a lot of those more broader family resource supports are, so you can get networked in.
Yeah, and there's also something on HSE.ie called Anxiety Disorders in Children. So they can also look that up if it was a consistent and became a difficult problem. So, Abby, we've talked a little bit there about parents preparing for their children to go back to school, but is there a toolkit you could really have in your house that would, in case you would need it?
It is helpful to have a few basic things in place, like a thermometer. Make sure you've got a thermometer that's working and that you know where it is. So when you've got the child who's unwell first thing in the morning, you're trying to, have a sense check, or overnight they've woken up and they're unwell, you know where your thermometer is. You can check the temperature, feel them first. It gives you a good understanding. But you've got your thermometer, you've got maybe, your liquid paracetamol, liquid Nurofen. You can go to any of your chemists and find those, liquid formulations that are suitable for the ages of your children. It sounds silly, make sure you have a piece of paper and a pen and write it down, because particularly if you're tired, it's the middle of the night and you've got more than one child, it can be, you can forget fast who you gave what to when. So, do have those few bits written down. Also, make sure you got it in your phone, the contact number for your GP, your out of hours GP service. National Poisons Information line is a really good one to have as well, because unfortunately, one of the things that they are contacted most about is about overdose levels of paracetamol and
Really?
Nurofen.
I didn't know that. Wow.
Yeah, it's a common thing. And that's why it goes back to have a piece of paper and a pen and write it down, because you yourself get tired and kind of confused, especially if you're not feeling the best and you might be giving yourself paracetamol too. Do have those things ready to write down. So that's the kind of the normal stuff. I suppose make sure you know where you would access help if you are seriously concerned that your child is unwell. And MyChild.ie has really nice information about, you know, if your child is seriously unwell, kind of what to look out for and what to do. But make sure you got your urgent out of hours number for your GP. Know where your nearest sort of urgent care is for relevant children of their age. So, you know, you've got that to hand should you need it, but hopefully not. Most childhood illnesses don't lead there, you know, just to reassure about that, but to make sure you do have those pieces of information is always helpful if you do need it.
Yeah, absolutely. So you're not panicking in the middle of the night or, you know, or first thing in the morning. And I suppose as well as just trust your instinct.
Absolutely. Trust your instinct.
I suppose now we have the child back at school. They have the lunchbox, they have the bag, they have the shoes, they have all of these things that really can cause children at different ages upset. You know, they want the same colour, they want to be the same as everybody else. This is even just from my own experience, you know, and it really caused them some distress. But we've got all of this stuff. They're back at school. What do we expect the first couple of months now? One that sticks in my head is the basic childhood illnesses that people get when they go back to school. It's coughs and colds. There's, you know, right, all of these things that you think you're prepared for. And it's only September and all of a sudden they're coming home with these different things.
Yeah, that's exactly it. And so that's another thing that, you know, I recommend people do think about in that preparatory time in August, kind of September, particularly if you've got sort of annual leave days, you're thinking about it, or the nature of your work, how you might manage that, because all children get sick. You know, they'll have multiple, I suppose, viral illnesses, especially the younger children. They tend to grow out of it a little bit more. But certainly at that younger age where you're preschool, early school years, they are going to get sick over the winter months. There's no two ways about that. So it's how you, one, manage that and manage when they might need to be at home. And secondly, how you sort of manage trying to sort of protect them from that sort of spread of infectious disease, and how you protect spreading onto others either at school or within the home. So really to kind of think about that. You know, it's likely if you've got a young child, they're going to be off school at some point, and how are you going to manage that within the family sort of household? So build that in. Another great starting point, obviously, is to make sure you have your vaccines, I suppose, to get that. So, you know, that's the best way we can sort of arm ourselves with the immune response such that it's not, you know, the problem is sorted before you're aware there's any problem. So really important that, you know, you have those catch up. If you've missed any of them, those 5 childhood vaccination appointments that you have as a baby from 2 months of age till 13 months. At junior infants, then they'll have their sort of top up booster vaccines for the 4-in-1 and for the MMR. So really important that they catch up on that if they missed it at all. But if they're going into junior infants, to make sure you can consent into that and have those vaccines.
So people will come into school and give them that vaccination. Yeah. So that right, our listeners know that somebody will be coming into the school and they'll get notification from the school, and just make sure that you...
Exactly, that you read that information. In the northwest of Ireland, sometimes it's given by the GPs up in Sligo, Donegal, but you will be informed how to access it proactively, which is great. So would say really, really important to do that. And the next other opportunity for routine vaccinations is in the first year of secondary post-primary school. Yeah. So, you know, forearmed is really the best thing. Make sure you got those vaccines on board. If you've missed any, not a problem. You can go back and get them either through the GP or through the HSE, depending on which ones you've missed. And then each year, I suppose, comes out around October time, there is the flu vaccine. And that's a fairly recent one, and that's been available to all children in Ireland, but it's been available for a long time internationally. And it's not even an injection, it's a squirt up the nose. And that has a great protective effect for children as well. So, you know, that's one way of making sure that the things that we can protect them from, they will be best protected from. So even if they get exposed to them, hopefully they'll be much less sick than they would have been otherwise. Or best case scenarios, you know, you never know they had anything because they were fully protected, which is fantastic. So get the vaccines on board. And then there are countless numbers of coughs and colds and those types of infections. And, you know, diarrhea and vomiting infections can be the other ones. And then there's all the normal childhood ones, like, you know, everyone wants to start itching when you talk about the sort of threadworms or the hair lice. You know, that's all really, really common. It's sort of nearly a part of childhood. There'll be someone, you know, or you get the message back from school that, you know, head lice has been identified. Please do the check, so to speak. I suppose not to panic about that. There's lovely information on the HPSC website, which tells you about what the sort of nature of some of those childhood infections are and when to stay home, when to go to school. And I suppose one thing that people have become much more cognizant of, much more aware of over recent times is that you can spread infection before you seem to be very unwell. And I suppose that's really where those hygiene measures came to the fore in COVID are still really important. The hand hygiene. So showing that good practice with your children about washing your hands regularly, making sure they cough and sneeze into the corner of their elbow or into a tissue, and they've got a packet of tissue in the school bag, for example, and they can throw it away. That's how you protect and minimize the spread to the rest of your family or to other children if they're in school, because that can happen before they were aware and unwell enough to need to stay home. So that's really where those good hygiene practices help minimize the impact for the school class and for the household setting. So would really encourage that those are important. And children take their cue by teachers, other children, and yourselves as parents, and whoever are the adults who are significant in their lives. So if we practice them, it won't seem strange to them, and by default they'll start doing that too.
So Abby, you mentioned the routine vaccines and you mentioned the flu vaccine, and we still have COVID. So we're talking about COVID vaccines, and there has been, different vaccines that kids have to have, and it's hard to keep up to date with them. So just in relation to that, into COVID vaccine, what would you suggest? Yeah,
so COVID-19 vaccination is available for all children, and it's recommended strongly for children who might have sort of comorbidities, who might be unwell or have
so comorbidities, just for our audience, what
chronic
would that
condition.
be?
So if your child is known to have a sort of a long-standing condition that they might be under the care of clinical services for a GP, a paediatrician or something like that, then it's particularly recommended for those children. So, again, there's good information around all the vaccines on HSE.ie. So I think we all know that there is sort of some vaccine fatigue out there, and I think we just have to sort of acknowledge it. But what is so important is whatever you decide about the vaccines, the core vaccines for children are absolutely crucial to make sure that they're up to date. We're, as an adult population, we're hale and hearty for having had the opportunity of vaccination being young. So it's really important that we confer that. So really do make sure all those core vaccinations are up to date. And then the flu and the COVID are the seasonal ones that come around, and really good information around those vaccinations will be available, and locations of where to get them.
And because even this year we've been hearing quite a lot about measles in different European countries and stuff. So those kind of illnesses, childhood illnesses, are not gone. And don't confuse the routine vaccinations with the COVID, with the flu, that to really the importance of keeping those up.
Yeah, really, really important. Have the vaccinations that you're recommended. Those core ones, we're talking about whooping cough, we're talking about measles. They are core foes of infectious diseases for us in terms of children's health for centuries, really. And, we've got vaccines for them. So it's really important. Measles will be a factor. Almost certainly lots of people would have travelled over the summer. European countries are seeing much higher cases of measles than we are even in Ireland. And we want to keep our cases low, but there's a way to do that, and that's to make sure that we have our vaccination and we're maximally protected and we get help if we've got any signs or symptoms of measles. So, that is a particularly important one, and there is, booster dose for the junior infants going into school there. So really important to make sure that, we have those vaccines, definitely.
I mean, I think through COVID, the whole thing about the way that we cough, the way we wash our hands, all of those things, and it's nearly like we need to not forget about them. We need to keep them, really encourage kids to do them, because it's everyday, normal coughs and colds. And I think the whole area around the lice or nits, or do they call it lice or nits now? I'm not really sure. But lice, the thing that kids come home and then they're really worried. Then they think, oh, were they the first one in the class? And then they're really embarrassed and they don't want to tell any of their friends. But I guess it's important to tell the school as well. If you haven't received a notification and you know that your child is itching their head, you need to get back to the school. And it's not anything to be embarrassed about. They're normal childhood illnesses.
Absolutely. Yeah. And it's more to give other parents, the heads up so they can check, because the sooner everyone deals with it, the sooner it's dealt with, and it stops. It stops sharing the love around when it is, particularly when it comes to sort of head lice. I mean, that's really the thing. Just not to be embarrassed about it. It's very common. No, those kind of infections that we don't want to think about, but then you can read up what to do with threadworms, head lice, etc. MyChild.ie has lovely information on what to do and how to manage that. And then I suppose there is often then the question and discussion around the kind of coughs, colds, and the runny nose. closes, and how do you know when someone needs to stay at home? And it's always that difficult balance of, we want children to be at school as much as possible because it's great for them, it's great for their education, it's great for their psychosocial well-being and development. And obviously for any children who might be anxious or anything, you don't want to break the routines as well. So there's all sorts of reasons, plus work and routine, driving us to keep the children at school, which is generally the right thing to do. But every now and then you need to just sort of sit back a bit and say, okay, are they quite unwell? Is that the best thing to do, both for your child and for other people's children, I suppose? Because some of the common infections are very common amongst young children and, maybe don't cause too much problems, but can cause significant ill health to, say, younger babies or to immunocompromised people who might be at school or within those family settings that there is a school-going child. So if your child is unwell, if you know in your heart that they're not well, if they're so mithered with the cold, they're so thick, they can't concentrate anyway. If they've got the fever, if they're really not on form, then that's where you need to put into action those plans that you've had of what we're going to do, because they're better off staying at home. One, because they don't feel very well is the best place for them. But secondly, if you've got an infection and you're unwell, you're more likely to get another infection. And because at the height of winter, there's so many different types of viruses circulating around, you're more likely to get another one, which will place them back. So it'll feel like they're unwell for a much longer period of time. They need that break, that chance to kind of recover. And when they are, I suppose, significantly better, then they can go back to school and use the hand hygiene and respiratory hygiene to make sure if there is any still infectious agent there, they are minimizing that onward spread. And that's not to say they have to be completely better, because it's really common that children are left with a cough that can last for a few weeks afterwards, but they're completely well. That's okay. They just need their cough hygiene. Just cover your cough, wash your hands. That's okay. So it's not out until all symptoms have all gone, but it's when they're unwell and that in your heart is apparent they're not well. So that's when we say keep them at home. And over that couple of days when they might be unwell, then you'll be clearer actually what's wrong with them. It might just be something that resolves and they get better, or they might have a rash and you realize they've got chicken pox, or they've got they've got some other condition that actually is maybe a little bit more serious and you might need to go to see the doctor about that. Pertussis whooping cough is making a comeback every few years. We see a surge of infection. It's increasing at the moment in lots of countries, and that's annoying for young children and adults, but it's really dangerous for little babies. So that's a classic example where you want to identify that. If they've got that classic whoop and the cough, you want to speak to your GP about that, get some antibiotics potentially on board and make sure that you're stopping that spread of infection. But you won't know that if you've sent, until you hear it. So if the child is unwell for those few days beforehand, keep them at home. And
I suppose trust your instinct with it as well. I mean, if your instinct is not, and I think what you said there about making that part of your plan, at the end of the day, children are going to get sick. This is normal. They're going to get these normal childhood illnesses. So have some kind of plan in place that if this does happen, and then you wake up one morning, who's your key people that you can call to help you within your family or friends or whatever, maybe they have to look after the kids or whatever plan you've put in place. The other thing I was going to ask you then about, if you've got kids going to school who've maybe got chronic conditions like asthma or things like that I suppose by keeping kids home, you're protecting those other children as well that might have these chronic things.
Exactly. Yeah, that's exactly it. It's, if you're unwell, you need to be at home yourself. So you protect your own child from getting further infection, but it also protects other children, because when you've got lots of symptoms, you've got something and you're spreading it. And, children are good at practicing hygiene measures when they're encouraged, but they're still not necessarily as dedicated or as fantastic as an adult might be disciplined to it. So, to protect beyond themselves and those other children in the class, that's another reason why it's really helpful to stay at home. But actually the principal reason is really for your child. One, they're not feeling well. And secondly, they're more likely to get infected with something else, which is worse for them and then worse for you as a family. So, it is hard, but certainly with younger kids, it is a factor, less of a factor with older children. And also they might be, they might be more able to manage the kind of childcare arrangements around that. But certainly with younger children, it is definitely something to kind of build into how we're going to manage this and explore that.
So, Abby, when you talk about chronic conditions and children do have chronic conditions, what would they be?
I suppose you'll know yourself, what your child is being diagnosed with. And I suppose common ones might be, asthma, which can be at a simpler level or more significant level for some children and impacts their school health more significantly. Other classic ones are anaphylaxis that parents would be aware of, that, a child might have a severe allergy for nut allergy, for example, or it could be something else. And I suppose epilepsy would be another one. So, but you'll know yourself what are the recommendations around that. And what is really important is that you have a discussion with the school and you make sure that they're aware of what some of the baseline signs and symptoms might be, so that, they know what threshold to be concerned, and most importantly, to have a plan of what to do. And if they need any medication that they're supposed to have at school, or might need sort of rescue medication at school, like an EpiPen or something like that, that school know when to sort of use it and how to use it, that you have those discussions with the school in advance. And, not to forget, okay, the usual is the usual when they're in their school building and everything is normal, but sometimes there's school trips, there's, different events going on. So to make sure that the school is aware that, whatever is in place needs to be a plan for those special occasions as well.
Yeah, and I always find it amazing, maybe children who have got asthma or whatever and they need an inhaler, they get so used to using it themselves and they really take responsibility for it and make sure they have it in their bag or make sure they take it when they need it, which is amazing. Even at a very young age, they can take responsibility for these things.
Yeah, that's it. And that's the importance of including children in conversations, because, they're great at owning their responsibilities as well, by and large, and there's always some children who might overly obsess about something, some who might be a little less worried about it, but you'll know that about your child as well, so you can communicate that with the school. But by and large, children are fantastic at minding what they need to do for themselves, so they just need support with that. Support at home, support at school. Yeah,
and talk to the teachers again, thank God for the teachers. And Abby, I wanted to ask you about the sleep routine, because I have to admit the sleep routine in my house was always pretty poor. And I take full responsibility for that myself. So,
ditto.
So for children going back to school, what is the kind of recommended sleep that they need?
There's no one thing that is absolutely the right thing for all children. So I suppose that's the first thing to say. But in general, children, depending on the age, need somewhere in the region of a good 10 hours kind of sleep. And absolutely over the summer, we all tend to creep. It's lighter, younger children don't want to, you're trying to say to them it's night's time, you're looking out the window and it's bright sunshine and they're looking at you like you're mad, so this just happens. It gets the creep, and that, in terms of the time that they go to bed. And for slightly older children, even though they know it's late, they're just enjoying being up playing in the evening. So that's all fine. But that's part of that sort of early mid-August start talking about we're going to have to go to bed earlier, and then by mid-August start actually trying to go to bed a bit earlier, and just sort of bring it back, because getting up in the morning can be difficult.
Absolutely.
And it's difficult,
and that's
for
where
a
the
parent.
Chaos starts. Let's be honest. Exactly. That's where the chaos
and
starts.
And the parent is trying to make sure they got all the clothes and the lunchbox and all of that kind of stuff. Plus you've got a child who's sort of rubbing their eyes and feeling sorry for themselves. So that's where, particularly if you've got a slightly anxious child, that atmosphere, that half an hour first thing in the morning can be quite critical to how it's going to go at the school drop-off gate. So, do try and push that sleep time routine, bedtime routine back a little bit, and try and make some nice family time of it. It is really hard, but it is important to try and carve out some time. So, you maybe stop everything that you're doing a bit earlier and start playing, some cards or a board game or whatever it is that the children like, just that little bit of time. We're going to do this now as a nice thing. And then it's kind of off to bed and up get ready for...
And just when you mention a card or a board game, and that always sounds really lovely, and we all do that around Christmas and everything, but the reality of doing it every evening sometimes doesn't happen. Now, we're not going to go into detail too much on screen time, because we have a podcast coming up in the next couple of weeks on screen time, but have you a few tips for parents on screen time, maybe even in relation to bedtime routine and that?
I mean, that's it. I suppose it's trying to sort of reduce the amount of screen time overall, as we know is a good thing, but there are lots of different types of screen time. But we won't, as you say, we won't go into all of that. But I suppose it's to make sure that in in the evenings, it's about drawing it back in. So recommend those screens are turned off maybe a little bit earlier than they have been throughout the rest of the holiday. So they start significant stimulation from whatever it is they're watching or playing, just sort of stop short a little bit earlier, and you can start having a chat or a walk or something a little bit more calming, depending on the age of the children. Playing a game for a few minutes or getting them to play a game doesn't always have to be with you. It can be a nice thing to try and get the siblings to do. But, to just try and change that sort of space a little bit. So it's all a little bit calmer, as you start that transition to bed. But I say calmer in the full sense of knowing what it's like with.
It is difficult. And then when we're talking about breakfast and getting up in the morning and trying to get kids to eat, and this is always a problem for me. I mean, that everybody, you can be in somewhat control of the lunchbox. And again, we've another podcast coming out about lunchboxes next week and healthy lunchboxes. But just in general, the importance of having that healthy lunchbox is really important for children. And after maybe the treats over the summer, sometimes it's a little bit, there might be a little bit of controversy, shall we say, in the house when you're sending them back to school and they get back into the whole only treats on a Friday. They're like, "Oh, Mum, like, how long is this week?
Yeah.
When is Friday?
When is Friday? Well, a lot of schools start that midweek. So, Friday's a bit sooner than, but it's absolutely true. But again, that's part of the preparation back. You start signposting this, isn't it been great? We've had more ice creams than usual or whatever it is over the summertime, but we're going to have to start getting healthier again, back into normal routines. And, thinking about what your child likes, what's appropriate for them and what's allowed in the context of the school. Sometimes you might have someone with nut allergy in the class and, you're not able to use certain spreads or whatever it is. So just kind of thinking about those things. But, the schools do a lot of great work about nutrition as well. And I think a lot of children are very aware of the need to kind of, be healthy. And it's one of those things, if no parent puts in treats when they're not supposed to, then children very quickly accept that that's the norm and they're not seeing anything particularly different there. And obviously for a lot of children now, hot school lunches is a thing and a routine, and it may be something that you need to talk to your child about in terms of, they might be a little bit anxious about what sort of food they are going to get, what it's going to look like, how they're going to manage it, so that may be part of your preparatory conversations as well. But look, eating healthily is really important for them to grow, for them to develop, to have a good, strong immune system, for them to be, the best health that they can have. It is really important. So a lot of children at a very young age do know that. And I think just exploring with them what they like. And again, sometimes things that you think they like, they might not like, and you might be surprised by some of the things that they do like, So
you can be very surprised at what they'll eat in other people's houses and at school, but they won't eat at home.
Absolutely.
So I always find that quite fascinating.
Yeah. And you tend to, as a mom, I tend to have a bias of, things that I like to eat. And then you realize that, one of the children might be quite different from that, but it's still very manageable, So it is about those conversations about asking, if we had to have something healthy, some fruit or, vegetable sticks or something like that in the lunchbox, what would it be? What would your top two be? And just ask them directly, It's part of those conversations. Kids generally know that they shouldn't eat junk all the time. Teachers do a great job at teaching that in terms of health. So, I suppose the more we can get on board and make that the norm for certainly within those school routines, the more it helps all of us in that.
Yeah, absolutely. And just when you're mentioning the teachers there, I suppose if there is an issue, whether it's around food or if you think your child isn't feeling well, it's like the teachers now, you just call the school, you just let them know, you communicate with them. If you're anxious about anything to do with your own child, it's amazing the relationship you can have with the teachers now and with the schools.
That's it. And, schools normally have, it's clear with your school what's the preferred way of contacting them. All schools are slightly different, so you'll know from your school, or you can ask if you're not clear what's the best way of having a conversation, and that can be really helpful. If you've got younger children, you just want to flag, they seem a bit out of sorts, but I'm not quite sure what's going on. Is everything okay at school? Or just a flag. Or if you are concerned that, particularly if you got, as you say, we said at the start, you might have a more anxious child going back in the transition, just to flag that so-and-so is feeling a little bit more anxious. This is what we've kind of been saying. Could you just keep the eye out? often schools put children in, tables to start with and put them sitting next to different children, and, they mix that up a little bit. But, that could be something that just while they settle in, it would be important for a child to be next to someone or close to someone that they, that they got on well with. So that's the sort of thing schools practically can look out for and to help with. So, it is important. Use the way the school wishes to engage kind of with you as that opening port of call. Use it and explain a little bit. And, normally these things can be sorted out at the lowest level of kind of inconvenience.
I think the teachers are so receptive to some suggestions as well. I mean, you don't want to be calling them every day, obviously, but sometimes, and again, mother of four, from a little bit of experience, I used to think, maybe just like, I'm not saying pull yourself together, but sometimes I thought with my oldest children, you'd be kind of give them a bit more of a hard time. Then you suddenly think, oh God, if I don't stick up for them or let the teacher know, who's going to tell them? So then maybe as you go along, then you kind of realize that you have to acknowledge the way they're feeling. It's very real for them. It's very real for them if they're not sitting beside their very best friend. And, so I think talking to the teachers really does help. And like you say, they might want to mix them up, but if there's some way they can sort it out, they will try and help.
That's exactly it. And, often they'll look to do that sort of thing so that someone settles in. And then you might find out that actually, they might be really anxious going to school, but there's not a bit of problem with them in school. And actually, if I put him next to her or those two together, then there'll be non-stop chatter all day and I can't have that. So you can get a completely different perspective as well. Yeah. So, that's why, if you're worried at all, it's just good to have that conversation. So someone else can look the other side. They might reflect a different picture back, or at least they know how you're kind of managing it. And sometimes there is a little bit of the good cop, bad cop as well. So, occasionally, you get to a stage where that might be required as well. And you can navigate that with, I know you want to go home, but, let's see, let's move on, let's do this class and see, before how you're feeling then, so there's a little bit of understanding of how to manage that, but that'll be something that you'd absolutely sort of negotiate kind of with the school if you're in that territory.
Abby, then going to physical activity, and we know we're constantly hearing about the importance of physical activity, and it's different levels of physical activity at different ages, and we're trying to encourage our kids to be more physically active. So what would be your advice and guidance on that?
Yeah, just engage with it and encourage it, I think, is the most important thing. Some of us, we're all different as sort of family compositions. Some of us are very active families and some of us are less active families, and a lot of us sort of in the middle who feel we should be a little bit more active but don't quite get to it because of routines and business and all of that kind of thing. But really the important thing is to positively engage with how you talk about it and show that we should be moving and, I suppose, having sort of a more active way of living. So for some, that'll be engaging more in sports and encouraging that, who's doing soccer this year, who's going to Gaelic or whatever it is, and encouraging them to go with their friends, even if they're not particularly sporty. For those who are sporty, it's generally sort of how many evenings can you fit in with activities, but to always engage in terms of what the school is offering, that there is, PE, they do have sort of green flag weeks or whatever it is, they have various activities, I suppose, to be very positive about your approach to that. And then at home, just encourage that sort of movement, come on, we've been on the sofa, let's all get up and move a little bit for a few minutes, and you just make a sort of bit of an in-house family entertainment about it, and then you all go off and settle down again. But I think it's partly that just positive exposure to it, positive talk about it, and some will naturally be more sporty than others, but we all do have to move and be a little bit more active.
And if it's part of the children's life from the very beginning, then it's just the norm. Again, we're just talking about these normal things that should, everyday things that are important for children to be part of the life, like the healthy lunches, like the physical exercise,
and
that
will
kind of
carry
thing
with them as they get older.
Exactly.
So, they're more likely to be healthier as an adult in terms of what they eat and how they exercise. And, we have to remind ourselves that a lot of the kind of normal ways of being active, have been removed over the years in terms of a lot more people used to have cycled to school, walked to school, all of that sort of thing. And a lot of that has changed for families. So, and for very good, for very logical reasons, but you then need to build that in a way that it was just part of navigating life maybe before. So it is about, okay, how do we build in getting, a family walk in or something, something simple. Definitely easier over the kind of summer, but not to be put off by the winter and to try not to have that, we can't do anything. It's dark or bad weather, because, it's dark and bad weather for a few months of the year. So
and we live in Ireland.
We live in Ireland, so we have to contend with that a little bit. So
this one is always kind of difficult, I'm sure, for children who do not like the regular sports that are played in the school, maybe the GAA, or they're just not inclined that way. And some children just aren't. They're not as flexible. They're just not into it as much as other kids. And I always think it must be really difficult because if you're not on that team or if you're not a good runner, like it's really hard for kids.
Yeah, it is. And I suppose that's part of being, you know, we need to be healthy, but you don't have to love soccer or GA or whatever.
Yeah.
You know, there are other things to try that, you know, might be an option for some families, for some children. Like, you know, the martial arts are very popular. You
Absolutely,
you know, gym or dance has always been popular for, you know, for other sections of the kind of school population. So, you know, to have a discussion about what is realistically an option for your family, for your child to see, can you get them interested in something? And if, you know, if they're not, there is the baseline activity within school that, you know, they need to do same as everybody else. There's always subjects that some children are better at than others, but I suppose we have to do the whole lot, and physical education is kind of part of that. But then it's like, if they're really not into that and, you know, it's really becoming an issue or a problem, or it's not something that you as a family unit can manage to allow children to go out to certain things, it's about how you can make the everyday more active, you know, running up and down stairs, or, you know, whatever it is, we have to go out for a little walk around the block, whatever it is, you know, that there is a positive, I suppose, that you consider how you can make the daily life a little bit more active for you and your family, and how you can be positive about that rather than sort of another thing to do.
It's another drag. It's a drag.
Yes,
it's a drag. Yeah. So, Abby, as we wrap up today's episode, I would like to thank you first of all, but I'd like to give you an opportunity. Is there anything else that would be important for us to cover in today's episode?
Well, thanks very much for the opportunity. It's great to try and support, I suppose, children and families out there. Look, at school return happens every year and every family gets through it. It's about providing information to support children and families. So there's loads of more details to what we've discussed today, loads of things that we didn't get a chance to discuss. So MyChild.ie is really a good place to start for parents to go and look at whatever it is that is of most, I suppose, pressing urgency to them or most relevant to them. So really recommend checking that out. And I suppose the final thing to say is, just as a parent, be kind to yourself. It's a busy time, and it's been on the back of a busy time. Summer is really enjoyable time, hopefully for most families, but it's often very busy and tiring. And then you're starting to get back to the routine and all of the planning involved. So just be kind to yourself. Take that sort of collective sigh of breath, particularly after the first drop off and for school, and you know, acknowledge your own separation anxiety, you know, particularly if you know, a lot of families are at home for a good bit of time while the children are younger. So, you know, there's an element for the parent as well to just take a breath and take stock of that moment and move on. So be kind to yourself. It's a busy time. There's a lot going on in family households, and just acknowledge that in your role in it. Very important role.
Well, thank you very much. And I'd like to very much thank you, Dr. Abigail Collins, Consultant in Public Health, a National Clinical Lead for the National Healthy Childhood Programme. Thank you, Abby.
Thank you.
So to our listeners, be sure to share and leave us a review if you enjoyed the episode. Remember, preparation and open communication with your children is key to a successful school year. Stay patient, stay positive, and don't hesitate to reach out to your child's teacher or your school if you need to communicate with them. If you would like more information about HSE Health and Wellbeing, have a look at our website at HSE.ie. Follow us on X, take a look at our HSE Health and Wellbeing YouTube channel, or register for Ezine today by emailing healthandwellbeing.communications@hse.ie. Join us next week when we'll be discussing healthy lunch boxes. Until then, take care and have a great start to the new school year. Thank you for tuning in to HSE Talking Health and Wellbeing.